Hi, myself Dr. Vivek Sasindran and welcome to yet another episode of ENT Talks. Today I would be continuing with my series of talks on rhinoplasty. So in the previous videos we did speak about rhinoplasty, we talked about the different types of rhinoplasties, and today I would be touching upon certain doubts that the patients generally keep asking us when we counsel them regarding rhinoplasty. So whenever a patient comes to you with a nasal deformity, the most important thing is to assess where exactly the deformity is. Is it a bony deformity? So when I say bony deformity, it basically refers to a deformity in the upper part of the nose. So that is where the bone forms the framework. Whereas the lower part is predominantly cartilaginous. So that is the reason why you are able to kind of move your nose easily when compared to the upper part. The tip is kind of slightly more flexible. Now you can have deformities involving the bony part or the cartilaginous part. Now to give you an example, now the patient has a hump. A hump is a projection over the dorsum of the nose. So when you look from the side profile, what happens is you see that the nose is not in a straight line, rather there is an elevated field. So this is what we refer to as a hump. So if there is an excess of bony hump, what we could do is we could expose that area and we could kind of chisel out that entire extra segment of bone, or we could even be more gentle by polishing out the extra bit of bone. So that kind of reduces that elevation and kind of flattens or straightens the dorsum of the nose. Now another example is if you have a crooked nose, if the nose is kind of bent to one side. Now that would invariably involve both the bony part as well as the cartilaginous part. So in those kind of scenarios, you will have to kind of fracture out the tilted bony part of the nose. So for that, what we do is we do something called as osteotomies. So through small tiny stab incisions, we are able to fracture this bone on either side and subsequently mobilize the deflected or the bony part towards the center. So you are able to realign this entire deviated segment by inducing fractures on either side and move it to the center. Now cartilage is a slightly more flexible material. So again, we can correct the cartilaginous deformities by trimming it, reshaping it and replacing it back. So if you see in primary rhinoplasties, that is rhinoplasties being done for the first time, most of the materials that we use for reconstruction, reshaping are from the patient's own body. So most of the time, the septal cartilage, the nasal septum is the source of material. So we can harvest the septal cartilage and we can reshape it and then put it back. Now in case you don't have sufficient material, you have options of harvesting cartilage from the pinna or the ear, or sometimes we even use fascia, which is a material that we had earlier described, which is used for reconstructing the eardrum. So sometimes we wrap the cartilage in fascia and put it back. So there are different techniques of doing rhinoplasty. However, a secondary rhinoplasty, that is a rhinoplasty which is done, or a revision rhinoplasty, not a secondary rhinoplasty. A revision rhinoplasty is altogether a different ball game. That is when the patient has already undergone a previous surgery with a deformity persisting. Many times we may not have adequate materials for utilizing within the nasal cavity. Now I would probably be talking about revision rhinoplasties in a different video. Thank you.